Hi, my name is Dr. Dharman, and through the Oral Health channel today we're going to be talking about the oral manifestation of peptic disorders. Let's start. So I've made this episode after a lot of research, and I found out that a lot of oral health problems and signs and symptoms are actually related to having gut problems, especially around peptic disease. Because if you're a patient who is suffering from coated tongue or bad breath or halitosis, burning mouth syndrome, recurrent aphthous stomatitis or recurrent aphthous ulcers, at the same time gingivitis, periodontitis and lichen planus like burning mouth syndrome like symptoms, without any particular or ascribable cause, and just the fact that you are having acidity issues, there's a high likely chance that there is a connection to it. So let me tell you something about how your digestion works. Apart from the fact that whatever enzymes that are there in your saliva and then it goes to the stomach, your stomach actually has an acid which is the hydrochloric acid, and the pH of it is very low. That means it is highly acidic. Thanks to God and the creator, the way the lining is made, it's helped because of the mucus. It helps in cushioning the so-called acidity impact. Owing to the fast-paced lifestyle which has become more sedentary, it has become more fast food oriented with preservatives and all these things, continental food and this refined sugars and all these things. The stuff that we are eating is now mainly junk. Secondly, we're not exercising enough. We're consuming stuff and performing lifestyle practices which are bad for our health in the long run, such as smoking, alcohol and all those things. So what I would want you to really understand is that the number of patients with peptic disease or acidity or diseases related to the gut have increased quite a bit because of the lifestyle changes and the kind of food that we are eating, because we're eating a lot of processed foods. Now, a lot of oral health lesions might not be ascribable to any other cause, but you get to see, if not a causal variation, you definitely see an association between the acidity, the fact that a person has gastroesophageal reflux disease, has constipation, has digestion issues. Now, if these things happen, you can get burning mouth syndrome, you can get dental erosion, you can get bad breath, you can get coated tongue, you can get candidiasis, you can get recurrent aphthous ulcers, recurrent aphthous stomatitis, burning mouth syndrome, lichen planus like lesions, and so many more. All of this is actually related to the fact that there is some sort of oxidative stress, apart from the fact that there is direct injury because of the acid that is either coming back up through the throat into your mouth, and the fact that there is a lot of chronic inflammation and stress present, especially around people who are smoking, who are drinking heavily, who are not sleeping well, taking a lot of caffeine and nicotine in their in their daily life, because of which they're having the circadian pattern, if it's very much disturbed for all of us because of the screen time and all those things. Because of all these things, we tend to develop gastritis, peptic disease. In worst cases, we develop stomach ulcers, duodenal ulcers, and sometimes carcinomas as well. So what I would like to really reiterate is, if you are someone who is going through something like this, who is having burning mouth syndrome, no ascribable cause, burning sensation in the mouth, aphthous ulcers, a lot of aphthous ulcers you're getting cyclically, if that is a thing, and especially if you're getting stuff like, you see that your teeth are now becoming very polished, they look very, they feel that they've become softened, and you feel that if it's been a chronic thing, you feel that the teeth have become, they've changed the shape, they've become more concave and all those things. If that is the case, then there's a high likely chance you need to go to the medical gastroenterologist and get yourself checked out, because of the fact of the reason that you might be having peptic disease. Since I speak to a lot of patients and my consultation time, actually I take my sweet time, and after doing the interview with the patient, when they keep on talking and they start to open up in front of me, they talk about a lot of things, and then they finally come to the conclusion, yeah, I take a lot of caffeine, or I smoke a lot, or I don't sleep properly, or I have a sedentary lifestyle, I take a lot of fast foods, and that's why I'm having acidity issues. And ever since I've had the acidity issues, these things have started propping up in my mouth. If that is the case, all you have to do is, apart from getting the dental treatment done from us, go to the medical side, to the gastroenterologist, and get yourself checked out, and it will do wonders for you. Small changes that you do on a daily basis will make a lot of impact in the long run for you, and you will lead a much healthier life. So that's it for today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you feel the need to call me, kindly drop me a message on WhatsApp. Here are my social media handles, and if you want to comment, put your apprehensions, queries, doubts, or anything else, criticisms or any suggestions, please do feel free to do so in the YouTube comment section. So that's it for today. Thank you.